This video tutorial gives an outline of the scope and content of the LEADER Guidance Pack for estimating the social costs of illegal drug use, developed as part of the EC-funded project LEADER, which stands for Looking at Economic Analyses of Drugs and Economic Recession. In this tutorial, you will learn about the positions and assumptions used in developing the LEADER guidance, the areas in which LEADER guidance goes beyond the standard calculations of social costs of drug use, the importance of standard presentation methods, and elements to consider in using and comparing your calculations. Social cost estimations are how economists quantify the negative consequences that illegal drug use has for society as a whole. As found in the LEADER reviews on social costs, there are several theoretical approaches to the estimation of the social costs of illegal drug use, and a great deal of heterogeneity in the definitions of social costs adopted as well as their components. While the practical calculations presented in the LEADER Guidance Pack can be applied with a variety of frameworks, the principal position of the LEADER Guidance for estimations is to carry out a cost of illness or COI study, which presents aggregate costs of an illness, considering all external costs of illegal drug use and comparing them with a hypothetical situation where no illegal drug use exists. One important assumption of this approach is that all relevant costs are opportunity costs, meaning that when an activity, such as an illness, uses resources and thus prevents them from being used for some other purpose, an opportunity is forgone. The LEADER guidance recommends using a simple structure to identify the social costs of illegal drug use according to their main components, shown here. Social costs consist of tangible costs, which can be expressed in numbers, and intangible costs, such as suffering or quality of life. Tangible costs can be further divided into direct and indirect costs, where direct costs express the value of goods and resources which are used to deal with illegal drug use and its consequences, and indirect costs refer to lost productivity. Direct costs, in turn, can be expressed as a monetary figure or a number of years lost, for example, due to premature mortality. Important theoretical issues which have to be decided while estimating the social costs of illegal drug use are which estimation approach should be used. The human capital or demographic approach, focusing on potential or actual loss, which some authors argue are complementary rather than exclusive. An incidence or prevalence perspective, considering only new cases of drug use or all cases, new, chronic, and former. The methods and examples illustrating the LEADER Guidance Pack represent a COI or cost of illness, prevalence-based, human capital approach, as the most popular in social cost estimation. The methods and accuracy of social cost estimations relating to illegal drug use depend a great deal on the availability and quality of statistical data. In many cases, these data show gaps or are not presented in the way that we need them. To obtain the set of data needed, researchers can first gather all the existing data from official statistical sources and public surveys. In the cases where official data are not available or are not sufficiently precise, we may use other techniques, such as using proxies, such as instrumental variables, where estimation is based on data believed to be strongly correlated with the data of interest, carrying out special studies to elicit the data, surveys asking for expert opinions on the issues, or using the results of other estimation studies. The LEADER guidance gives detailed explanations of the most relevant of these techniques to fill data gaps. Several international institutions maintain large databases which can be used as sources of statistical data. For instance, the World Health Organization, particularly the European Health for All database, the European Commission's Eurostat office, the European Centre for Drugs and Drug Addiction, or EMCDDA, the Organisation for Economic Cooperation and Development, which has a general database as well as one dedicated specifically to health statistics. However, although the richness of international data gathered is increasing every year, in many cases there are still too general for social cost estimation. Therefore, for the time being, national statistics remain the main source of data recommended for accuracy. One of the most important things while researching the social costs of illegal drugs is that the data sources should be clearly documented and described, including reliability, gaps, and other potential shortcomings, to allow replication of the calculations, and so the reader realizes what weight can be given to the results of estimations. Our hope is that the Leader Guidance Pack will constitute the first step in consolidating a standard way forward for performing studies on the social costs of illegal drug use. The methods and examples presented cover the main aspects of the estimation of social costs of illegal drugs, consistent with the recommendations for a minimum framework coming out of the Leader review of existing guidance documents in estimating the social costs of drugs. The estimation of the social costs of illegal drug use can be expanded in many ways beyond this minimal framework. Some of the issues which require further research beyond the scope of this guidance pack include private costs, that is, those attributable to consequences of drug use for the users themselves, costs for those in close contact with the drug user, intangible costs, including the quality of life of illegal drug users and their families, costs estimated according to the demographic approach, costs estimated according to the incidence approach, lifetime productivity costs estimated for the entire working life that prematurely deceased drug users could hypothetically live, identifying the subjects of the costs, who bears the costs, the broader environmental consequences of illegal drug use, sensitivity analysis, taking into account the consequences of the approach chosen, assumptions adopted, and the shortcomings of the data sets applied. In the LEADER project, we aimed to push forward the field of social cost studies by presenting coherent and valid estimation and calculation methods and components, which are not necessarily widely used, but which could improve the accuracy, depth, and usefulness of social cost estimations for illegal drug use. The LEADER guidance includes estimation of mortality rates for drug users, the estimation of loss of life expectancy and life potential as a consequence of illegal drug use, using Helvig's method to compare different social cost levels between countries, taking into account multiple factors in the countries related to drug use. These two techniques will be briefly described here. For a full and more detailed account, see the LEADER guidance document itself and references by Sofia Malewska-Kubian, which are listed in the document. As well as quantifying the years lost through premature mortality due to illegal drug use, the loss of life expectancy and life potential attributable to drug use can also be calculated. These add layers of context and details to the standard figure of lost life years, and as such can be important calculations in terms of policy decisions and advocacy. The loss of life expectancy calculations start by obtaining the mortality rates for three defined groups in the population: drug users, non-users, and the whole population. From these, life tables can be estimated, which are theoretical models applied to the analyses and comparisons of population mortality. The LEADER guidance authors suggest using MORTPAC, the freely available United Nations software package for mortality measurement, to construct the life tables. A link to access MortPack is given in the guidance document. The most important outcome is the life expectancy of newborns, denoted by E_0. The comparison of these values in the three population groupings enables an estimation of the life expectancy lost in terms of years in the population of illegal drug users. A person's life potential varies with age because when they are younger they have more years of life expected ahead of them. It is also possible to consider the life potential of a population, which is understood as the number of years that the whole population, partly composed of drug users, is expected to live. Such a measure is especially valuable from a social point of view, and in this case it enables the estimation of life potential lost to society because of illegal drug use. Starting with the life expectancy calculations described previously, the life potential for the drug-using and non-drug-using populations can be plotted across the lifespan, as in this graph, which shows the data for men in Portugal in 2010. The loss of the life potential due to drug use can be seen clearly. It is the orange area in comparison to the general population, and the orange added to the blue area in comparison to the non-user population. For social cost estimates to be truly useful to those who shape and design social policy, it is necessary to know what part of the costs can be potentially avoided through appropriate social policy initiatives and behavioural changes of the population of illegal drug users or potential illegal drug users. The standard ways to quantify these avoidable costs are the estimation of the feasible minimum, in which researchers use epidemiological data to explore how social costs of drug use could be reduced under circumstances of different risk factors. The Arcadian normal, which is defined as the lowest age-standardized mortality rate for each cause of death within a group of countries with genetically similar populations and comparable living standards. It is estimated how many lives would be saved if mortality rates in a given country were equal to the lowest ones among the compared countries. One shortfall of these widely used methods is their limited capacity to take into account multiple factors of a phenomenon as complex as drug use and resulting harm. For this reason, the leader guidance also includes an explanation of a method which draws on multidimensional theory to estimate avoidable costs, Helvig's method, which can be applied to cases when as many characteristics of the phenomenon have to be taken into account. This method involves constructing one variable, called a synthetic variable, based on several variables characterizing the phenomenon under study, in statistics referred to as diagnostic variables. For example, the main causes of drug-related deaths and morbidity, overdoses, diseases, accidents, and so on. An ideal model is built consisting of the most favourable variables found for the diagnostic variables in the countries included, and every country is compared to this model to estimate the avoidable costs. Part 3 of the Leader Guidance PDF document gives suggestions for synthesizing and presenting social cost estimates in a standard way. The Leader Guidance authors suggest presenting the social cost estimates in the following way: prevalence of illegal drug use in time, space, and according to the type of drugs; prevalence of use of drugs, total and according to gender and age; estimated attributable fraction of mortality related to illegal drugs and according to gender and age; estimated mortality entirely and partly attributable to illegal drug use; summary results of the social costs estimations; estimation results for avoidable mortality. The guidance document gives illustrative examples of how to present each type of social cost estimation in data tables or graphic formats, including a summary table 11.5 in which all the social cost category estimates can be shown together. The Excel tool, which is part of the Leader Guidance Pack, allows users to put data from their own jurisdictions, calculate the cost estimates, and generate figures to present the outcomes of these calculations. Part 4 of the document provides supporting information in 3 annexes. The first gives considerations on sampling theory used, including different sampling methods and techniques to deal with survey errors, such as non-response or respondents errors, which can be particularly common in surveys about sensitive topics such as drug use. The second annex covers the basics of using a regression function in Excel and guides readers in the interpretation of the results. The third annex provides guidance on graph construction in Excel, aimed at improving the intuitive presentation of social cost estimate study results. The Leader Guidance Pack tool, as well as other Leader outputs, are publicly available for download from the Leader project website. The next Leader video tutorial focuses on the second work stream of the project and gives an introduction to the review, analysis, and primary research work carried out on the impact of economic recessions on drug use.